Hello everyone, I'm Tarini here. Today, my topic that I'm here to present is schizophrenia. Schizophrenia is a generally misunderstood mental disorder that is characterized by continuous or relapsing series of psychosis. Throughout this presentation, I'll explain the concept of my infographic poster and it will be followed by the definition, the types of schizophrenia, symptoms of the syndrome, the effects it caused, and the treatment that's available for schizophrenia. And there's also a mini story about the people who had it once upon a time. The importance of mental health and the awareness I could imply in our community about schizophrenia also will be explained. And of course, the statistics will be shown. This is my poster. I have added some pictures, charts, and little bit of words to prioritize my main topic textually too, which is schizophrenia disorder. Okay, first of all, what is schizophrenia? Well, let's start with the term, okay? Schizo here means split, while phrenia means mind. Even though here it could be interpreted as splitting of mind, it does not refer to split personality like some people misunderstand it, but rather schizophrenia describes a fragmented pattern of thinking. It actually is a serious mental disorder that makes it difficult for a person to think, behave, have an emotional sensitivity towards, and to comprehend the reality and also with, communicating with others. There are 8 types of schizophrenia. These can be categorized into two, which are personality disorder and psychotic disorders. Schizotypal here is the only personality disorder, personality disorder here. The patients with this type of schizophrenia tend to be eccentric and will always be filled with the weird magical thinking. They have some odd beliefs, okay? They might even dress weirdly sometimes, like the doctor in Back to the Future. You wouldn't get that reference if you haven't seen him, but of course. The psychotic disorder, schizophreniform, schizoaffective, and etc. But nowadays, they're also canceling out most of the types like catatonia here because it's less likely to get it. There are psychotic disorder due to another medical condition, brief psychotic disorder, substance-induced psychotic disorder, unspecified is sometimes the type of schizophrenia, right, has different features from the other disorders. So those are still unspecified, that is why. As schizophrenia is a syndrome, there are a lot of symptoms that might be associated with it. Different patients go through different effects. But the symptoms always can be broadly specified into 3 major categories, which are positive symptoms, negative symptoms, and cognitive symptoms. Today, I'm just going to explain the positive and the negative symptoms. Positive symptoms are basically something that's already in our body that reacts higher when we are sick. Like when we are feverish, when we have fever, we already the body temperature that we already have is higher than the normal temperature. That's when you are feverish, right? So that's it. So in schizophrenia, patients have positive symptoms which aren't positive in the sense that they are helpful, but positive in a sense that they are some new features that has some normal or physical counterparts. Okay, the positive symptoms of schizophrenia are delusions, hallucinations, disorganized speech, disorganized or catatonic behavior. None of these symptoms occurs physically, by the way. Let's start with delusion, shall we? Delusions are false belief where the patient might believe something so strong as they wouldn't even change their mind if there's an evidence against their belief. Okay, there are 2 types of delusions. One is delusion of control, where they think their actions are controlled by someone or even an alien. The other delusion is delusion of reference, where they think all the insignificant marks are directed at them. Like when they are watching TV, there's a character speaking and they'll think that the character is trying to send a message to them, trying to contact them. Okay. Hallucinations. Hallucinations can be any kind of sensation that's actually not there, including visual and auditory sensation, like hearing voices of command all of a sudden, or imagining something that doesn't even exist. Like they could even hallucinate a giraffe with wings, and they'll be like, oh, see, the giraffe is flying, it has very big wings. Okay, that's hallucination. Disorganized speech is the third type. It's usually considered as word salad, which seems just like a random jumbling of words or phrases here and there. For example, sentences like um, green water parrot clock. It wouldn't make any sense to us though, but it's for them. They will jumble the words. Disorganized behavior is something they do with no purposes to their action, like wearing multiple layers of clothing on a very hot day. It's hot, but they wear it. So it would seem bizarre and silly to us. It's also sometimes described as catatonic behavior, which is based on their movements, postures, and responsiveness towards something. Like suddenly they cannot move at all. They will enter the stupor mode sometimes. Negative symptoms are when normal process has reduced or removed to nothing. They'll tend to not show any emotions that they should have expressed in their daily life, or they wouldn't show any interest in something that they did once upon a time. Okay, there are three kind of negative symptoms, which are flat affect, alogia, and evolution. Flat affect is when they give the inappropriate response to a situation, like even if something unexpected all of a sudden it happens also, they'll be just quiet and watch with no response, with no expression at all. Okay, alogia, however, is poor speech skills. The answer to a question that requires long answers will always remain with just a word from them. They have poor speech skills. Evolution is when they have no motivation to go out or reach out for their friend. They would mostly want to be alone, spend some me time. Moving on to effects that is caused by schizophrenia. Firstly, more mental issues like anxiety can be triggered. The patient will go through an overwhelming fear of being watched by someone, or have severe paranoia, which can trigger a panic attack. This can cause embarrassment for them, which wouldn't end very well. It would be very good. It wouldn't be a very good thing, because they might even have an anxiety attack followed by the panic attack. This will also affect their efficiency at work. They can't focus much, so will be unable to maintain a job or a stable life. Like, okay, if they are working in a law enforcement and suddenly have an attack, a panic attack, in the middle of a stakeout or when shooting the criminal, pretty much a big issue for them. So it will be leading them to have financial difficulties, and so when they are deep down in inability to manage finances, they might even go homeless and get more depressed over that issue. Next one is substance use addiction. Okay, now just imagine that you're hearing voices inside your head all day, every day, asking you to do something that you don't even want to do, like forcing you into it, like some illegal and evil stuff. Okay, you want to stop that voice from talking more and more, right? So what do you think they will prefer to block out those villainy voices? An easy way, don't you think? Yes, they'll opt out for drugs because they believe under the drugs influence they wouldn't mind the voice's command as much as a sober mind would have. Okay, and it will lead up to addiction. If the voices or the symptoms becomes overbearing for them, they might even attempt suicide, which is unfortunately so common in schizophrenia cases. They just want it to end so badly, they just want them to go away. Okay, the statistic shows many deaths annually, and it just keeps increasing. You know, it's actually hard to reach out a friend who's diagnosed with this disorder, because they'd give anything to be alone, because they just fear hurting someone because of the voices, hence the part they will be isolated. Isolation can be so lonely and it might actually deteriorate their mental health more rapidly. When they try to isolate themselves because of the thought of harming others or oneself, they tend to end up in relationship conflicts. They'll neglect the people who care for them, like family, friends, and loved one, at all costs, hence ending up alone. Now, treating schizophrenia can be very tricky. They will need lifelong treatment even if the symptoms have subsided. Usually, medications are often used to treat the schizophrenia patients, but it is also very important to combine the several guidance of clinicians and efforts of health professionals like professionals in therapy or counseling, medicine, and psychopharmacology. Okay. As for medication, antipsychotics can be very effective at reducing symptoms, but they often bring along some additional problems to worry, like cost of the medicine you're going to pay for, and the unwanted side effects like dependence and withdrawal problems on basically a prescribed drug. Okay. The patients will be hospitalized for some time. It depends, because in serious matters they'll need someone to watch over them. Okay. Their activities. Okay. Sadly, majority of time, if the case is severe, they'll spend their entire life in the hospital. Psychotherapy, well, that is a treatment that is usually guided by a psychiatrist who has experience treating schizophrenia cases. A psychologist, social worker, a psychiatric nurse, and even a case manager may be part of the treatment to help organizing care. Okay, now it's a mini story time. These are a few famous people who had schizophrenia. First one is Zelda Fitzgerald. She was the wife of Scott Fitzgerald, who has written one of the greatest literatures in this world that's still being taught in some schools in overseas, which is The Great Gatsby. I bet even if you have not read the book, you must have at least watched the movie with Leonardo DiCaprio in it, right? Okay, getting back to Zelda. She was always known to throw misfits in public in regards of her husband's unfaithfulness to her. She was paranoia 24 by 7 and was always dismissed by her famous overbearing husband. At the age of 30, she was diagnosed with schizophrenia. Later, after some observations and treatments, she was moved to a psychiatric facility because her symptoms progressed. But when she was released, her dad died, her husband left her, and her health deteriorated again. So she had to go back and spend most of her life living in a psychiatric clinic. She died at the age of 47, quite young if you ask me. Next one will be Edward Einstein. He was a son of the famous Albert Einstein. Remarkable, isn't it? Edward was a very successful student, intelligent too, who wanted to be a psychoanalyst. Ironic. But unfortunately, he began showing signs of schizophrenia by the age of 20 and was institutionalized by like several times. He died in an asylum at age 55, but his family lineage has been used to raise public awareness of schizophrenia since then until now. The last one will be Mary Lincoln. She was the wife of America's 16th president, Mr. Abraham Lincoln. She was a very well educated and ambitious woman whom also supported her husband's political journey throughout her life. At the age of 44, she lost her son and her husband died after some time too, consequently, which she also witnessed actually. So after going through that kind of loss, she had mood swings and all of the symptoms showed the psychiatrist, and the psychiatrist confirmed that she suffered from schizophrenia, and she died at the age of 64. Well, guess what? You might know these people or the one they were related to. But would you have ever guessed they had schizophrenia? No, right? Well, they did, it seems. So, guys, I have explained everything I could about schizophrenia. That's my part in mental health awareness, helping people to avoid misunderstanding schizophrenia with other disorders. Mostly, they would be misunderstood with bipolar and split personalities. Um, who knows? Maybe you were one of them who misunderstood. So, I hope you're clear now. Most of us give importance to physical health more than mental health, which isn't supposed to happen. We have to give equal importance or more so for mental health because it affects our whole physical nature too. Okay, so by not acknowledging mental health, we are endangering ourselves and others too. Okay, please do keep checking up on your friends and family to see if they are doing good, and of course take some me time, take care of your mental health too. Well, all the infos in this era are just in our fingertips, so you can go search about other mental health issues and get to know them briefly. Can be very handy, especially in a pandemic time now. Hope you're doing good, by the way. There are still some people who are unbelievably narrow minded about these mental disorders. They still believe it's something to do with possession by ghosts or punishment of not believing in God, or more so nonsensible reasonings. They don't make any sense, do they? We can see this, I know it all, people in social media talking ill about mentally challenged people or someone diagnosed with mental disorder. Okay, I hope by this they that kind of people can be more open-minded about mental health and not blame on some superstitions. Okay, this is the world statistic of schizophrenia cases. I'm sorry if it's too small, but the main point is it has been increasing all over the world. America and Africa has the highest percentage of schizophrenia now. Asia is actually on top too. It's saddening, but the truth. By overall, okay, we should know that schizophrenia seems to be happen slightly more in men than women, with onset mid 20s in men and late 20s in women, like the examples I even gave you, the famous people. The clinical symptoms for women, which is like delusion, hallucinations, or even some physical changes, will also be less severe for them than for women, for men. Okay, studies has acknowledged this is because estrogen regulation of dopamine systems, and also racial difference doesn't matter in schizophrenia. It's all same for every ethnic. Okay, and there are 20 million people worldwide affected in schizophrenia in today's date. And ta-da, that's the end. Thank you for your time. I hope you learned something today. Thank you.